Welcome to CLL Testing 101. There are many types of tests that you may need during your CLL or SLL journey. It's important to know what the tests are for, which tests are needed, and which tests are not necessary.
There are four main categories of testing. They are diagnostic, prognostic, predictive, and testing for measurable residual disease, or MRD.
Diagnostic testing is when a test is performed to identify the presence of a condition or disease. The two types of diagnostic tests performed are a blood test called a complete blood count, or CBC with differential, and a flow cytometry test.
CLL and SLL are commonly first suspected when routine annual blood work is drawn and an abnormal lab result is found within the CBC with differential. To dig a little further into why the CBC might be abnormal, your healthcare provider performs a flow cytometry test to look more closely at the surfaces of your blood cells to see if CLL or SLL cells are present. Prognostic testing helps to determine what the likely outlook will be during the course of a disease based on the outcomes found previously in a group of people who had similar clinical characteristics as you.
CLL and SLL present differently from person to person. Many have a type of the disease that allows them to live for decades without ever needing any treatment. Some have a form of the disease that may require aggressive treatment right away. Others may be able to wait to start treatment until many years after being diagnosed.
For most cancers, staging is the process of determining how much a cancer has spread and can help determine a person's individual prognosis. Usually, staging is based on measuring the size of a tumor with imaging tests and looking at what other organs the cancer has spread to. Since CLL or SLL is a blood cancer that occurs throughout the entire body, a staging system that measures tumors is less important. Prognosis depends upon blood cell counts, physical exam, and the degree to which the liver, lymph nodes, and spleen are involved. In the United States, the most common way to determine prognosis and level of risk for CLL and SLL is using the RAI staging system, which is based solely on blood tests and physical exam. There are no imaging tests involved. The RAI staging system divides CLL into 5 stages from 0 to 4 that describe the level of risk and help determine how to best manage the disease when combined with the information from the other prognostic factors. Along with staging, there are a minimum of 3 tests that should be performed upon diagnosis to help determine an individual's prognostic factors. These tests are called FISH, TP53, and IGVH, and are usually obtained from a blood sample, although they can be tested using sample of bone marrow. Prognostic factors that tend to be linked with shorter survival times are called adverse prognostic factors. Those that predict longer survival times are called favorable prognostic factors. It is important to remember that while both adverse and favorable prognostic factors are used to predict what may happen, individual prognostic factors are not meant to be a one-size-fits-all approach to determining prognosis, since each individual person has a unique type of CLL or SLL.
What is a FISH test? Each of our cells contains DNA, which is packaged into 46 strands called chromosomes. Every cell has 2 copies of each chromosome. 1 copy was inherited from each parent.
These chromosome copies can become damaged in cancer cells.
Sometimes there are entire chunks of a chromosome that are copied and moved to another chromosome, or they are just plain missing, which we call deleted. FISH testing helps analyze the chromosomes we are particularly interested in looking at for CLL and SLL, which are the ones called 17p, 13q, and 11q. With FISH testing, we can also see if there are any extra chromosomes or copies that aren't normally there. For CLL and SLL, we are also looking for the presence of the extra chromosome called trisomy 12. 2 other important prognostic tests that are necessary for those with CLL and SLL include looking for mutations of 2 genes called TP53 and IGVH, sometimes called IGHV. TP53 can mutate over time and with treatment, so it is important to retest before you start each and every treatment cycle. Their status will be used as a guide when choosing what type of treatment will be effective for you. When your 13q chromosome has been deleted, with no other chromosome abnormalities found by FISH, and when your IGVH gene is mutated, this is considered favorable and generally means your disease progression will be slow and you may have a better outcome. Conversely, when your 17p and 11q chromosomes are found to be missing, also called deleted, when the TP53 gene has mutated, or when the IGVH gene is found to be unmutated, these results are less favorable or adverse and mean your disease progression may be more aggressive and earlier treatment may be necessary. Also, the finding of the extra chromosome, called trisomy 12, is considered an intermediate risk factor. Its impact on treatment choices is presently unknown. It is important to remember prognostic test findings are based on general findings for a group of people. Having one adverse finding or even a favorable finding alone does not mean that is how your disease will progress. Every individual is different. Predictive testing provides your healthcare provider with information that will help to determine which treatment option will be most effective for your type of CLL or SLL. For example, your test results will determine if you will be resistant to chemoimmunotherapy or if another type of approved treatment would be better, or even those treatments being studied in clinical trials. Another type of testing is called MRD. It is a test that is performed after you have undergone treatment to see if you are in remission, or during treatment to help your healthcare provider know if it is time to stop or modify the treatment. It may be run from a sample of blood or bone marrow. Currently, MRD testing is most often used in academic settings and clinical trials. It is not yet a standard of care for CLL. If your MRD test cannot detect any CLL or SLL cells, you have undetectable MRD, which is excellent. MRD is sometimes used while patients are in remission to see if the cancer cells are returning and to what degree. Researchers are increasingly interested in using MRD status to guide when treatments should be stopped or started, but more research is still needed to support this approach. It's important to know that if your MRD status is undetectable, that does not equal being cured. It only means that CLL or SLL cells were not found and your disease is in remission. It is also important to understand that detectable MRD is not always bad, as some MRD tests are more sensitive than others and can even detect a single cancer cell among 1 million normal cells, which would be considered detectable. MRD is an evolving technology that must be individualized to each patient. In summary, it is important for everyone diagnosed with CLL and SLL to receive these critical tests to assess the aggressiveness of the disease and determine which medication is most likely to be effective. At minimum, FISH, TP53, and IGVH testing is needed upon diagnosis. FISH and TP53 can change over time, so they must be retested before starting each and every new treatment. And testing for IGVH mutational status only needs to be performed once, as it does not change with time. Remember to test before treat, discuss the importance of obtaining these necessary tests with your healthcare provider, and advocate for your best possible care.